Right after I graduated from physical therapy school, I was looking all over the place for a clinic or a hospital where I could get really good orthopedic experience. I wanted to be able to see a lot of different diagnoses, a lot of different types of patients, because I knew I needed a good orthopedic foundation for the rest of my career. And that was Texas Orthopedic Hospital. I looked all over the place, and this was just the best one for me and what I was looking for. I have to be honest and say that when I started this job, I thought it would just be my first job out of school and I would be here for a year, maybe 2 years. And at the end of this week, it will be 4 years. So I can't leave. I love it here. I really do. My coworkers are great. I look forward to coming in and working with them. We all work out in the clinic together, and it's so nice because you can toss around ideas or ask one of your coworkers if you're having some trouble with the patient. So that part of it is great. The patient population here is exactly what I was looking for, and I really like working with people, whether it's a knee or a shoulder or a spine. I feel like I get to see a very wide variety of people, which keeps things interesting. I think the best thing about my job is helping people get back to living life the way they didn't necessarily think they would be able to get back to. After you have a major surgery or after you injure your neck, your low back, your shoulder, people think that they may not be able to do most of the things that they really enjoyed doing before they got hurt. And so one of the best things is seeing patients get excited when they realize that they are going to be able to get back to kind of a normal and enjoyable life. And I really like seeing that too. It's a lot of fun for me when I see somebody who has been so scared of re-injuring their back and to kind of get them back on an exercise program and teach them that they can return to the things that they liked and that they're not necessarily going to, cause themselves a huge setback. We give them tools to help manage that, and that is really rewarding to help somebody get back to doing things that they didn't know they'd be able to do. One of the things that makes it really easy to work with the doctors is the fact that their offices are one floor above our clinic. So it's so nice to be able to run upstairs and ask them a question or get their ideas on how to treat a patient if I'm having some difficulty. One of the great things that we started this year with 2 of our spine surgeons is a walk-in spine clinic where the surgeons will see the patients, and then that very day the patient can come down and see us in therapy, and we can get the patient started on an exercise program, which has helped a lot of patients get better faster because we can get them in much quicker.